diffuse pain, so perhaps it can be because of the fat, it can be because of these plantar muscles, but some patients are going to complain just a very local spot here in the insertion of the plantar fascia. So in this case, you could be going to the medial side just against this area of locating pain. Okay? Well, what can we do with these muscles? If you remember the ultrasound image, we can have a muscle which is, this is the muscle belly, attaching here, very central, and we have two other muscles, lateral and medial, okay? The abductor hallucis and the abductor digiti minor, okay? So, if we do this approach, we have to select which muscle. But if we do this approach, what we have to select is the layer. Because, for example, if we insert, I'm going to put the needle. I don't know if you see better from here.
Size of the needle?
But for example, well, it depends, but if you take a needle and you put here, you see this is very superficial. It will be half 1 centimeter, so if you are inserting this, you will be in the ultrasound in the image of the flexor digitorum, okay? Anyway, what I can do is to try to move deeper or more superficial. But if I want to go to the quadratus plantaris, what I have to try to do is I can take the reference of the bones and say, well, I don't want to hit the bones, but I want to be a bit deeper. If you remember, it was about 2 centimeters, 2.5, 3, okay? So possibly this will be 3 centimeters, okay? So we have this option and this option. So where are we going to find the trigger points? Well, if you, puedes cambiar un momento para que vean la zona de localización. If you have a look, no, ese mismo, sí. If you have a look, we have some tendon, some attachment, so we have to find them in the mid part. So if we have the heel here and the tendons here, all these are tendons and all these are attachments. So mainly the area we are going to cover is this. So this is the muscle area. So we should be doing for muscle the insertion here or in these areas. If we go to the insertion, because it's very located, we can go here or here, okay? So in this case, sometimes it's very easy to palpate, because when we palpate, we can feel clearly at first, at least in the first layer, a thickening of the muscle. So what I usually do is to palpate here or even to move a bit, okay? But for example, if I palpate, here I feel a thickening, here I feel it better. So for example, if I would have to do in some place, I would do it here. Is it more painful for you or not?
A bit.
This one?
The one, please. This one.
Or this?
Yes, this
So between this and this?
one. Yes.
This one?
Yes,
No.
Or the other? This? Or?
Let's move the
Doctor, you are looking for which muscle now? Quadratus?
This is, no, this is for the flexor digitorum brevis. But with the same insertion, if you just go a bit deeper, the second layer you have it.
You are doing just this direction. Or you will do the
Yeah, depending. So if the patient can tolerate, my preferred approach is this, because this is very direct. But if the
But this is
patient...
painful, I think, this one.
Yes?
This is much more painful. This one.
Yeah, but some of the patients can tolerate well.
Can I
So
do it,
when the patient can tolerate well, I prefer this because the approach is more direct, you are palpating very directly. But if the patient sometimes is not tolerating, it's not so good for precision, but yeah, usually go from this medial part. Or sometimes you can even go from the lateral. It depends on where you find the point. For example, if you find more here, you choose this lateral approach because there is less distance. If you have more here, more from this medial. But usually it's very central, so more or less it depends on you, okay? Another option, depending on how you are, perhaps here is a bit difficult for me to do it, but if not, what you can do is to place the patient like this. You try to fix the patient, okay? Because it's very easy that he can move. So sometimes what I do is to give a lot of support, because I'm giving support here, I'm supporting here, because it's very easy, the patient is moving. So for me, this is very comfortable because I can control everything, okay? So sometimes if I'm palpating here, my option is to say, okay, I'm inserting the needle here, but I'm concentrating to feel that under my finger, I'm feeling the needle or I'm feeling the twitches, okay? Or if not, if he's a brave man, I can do it directly, okay? So, people from Bilbao, only people from Bilbao tolerates the insertion here. Okay, I would say 1, 2, 3 then.
Yeah.
Women tolerate more than men.
Yeah. I don't want to recognize it. I always joke with my colleagues because sometimes it comes a strong guy and it starts to cry.
Needles, he will faint.
And sometimes it comes a thin woman, it doesn't seem, and you are doing and you ask, but are you feeling pain? Yes, but you can do it.
Yes.
And then my wife says, this is the reason we give to birth,
Yes.
and not you.
Exactly.
So don't record this, please. Well, so for example, now, I feel a bit of thickening here. This is your painful spot, okay? So, if I want to reach here and I want to be, well, not very painful, perhaps I can reach it from here better, okay? So, I'm going to put the needle here, superficial or deeper, depending on what I want, okay? So, which is the needle length I'm going to use here? What do you think? 4, possibly, as I can depress this, with 4 is more than enough, I think, okay? The only consideration I have to do is that if when I'm here, I want to chain and make it a bit oblique, I will spend a bit of more needle. So I'm going to put the needle. So here, for example, this is very superficial, okay? If I do here, it's a bit deeper, but I can always change this, okay? Well, we are going to be a bit deeper to cover both of them. So, prepare. 1, 2, 3. Okay. So now, what I'm going to move it. So first time, very gentle to check if everything is fine. Sometimes I can be needling, for example, this adductor hallucis brevis, sometimes the flexor hallucis brevis, so sometimes I'm going through other muscles, okay? So I feel some twitches, but I don't feel it behind my finger. Here, yeah, here, I feel it a bit. Now, okay. I'm going to chain a bit more superficial. Here, here, so deep, okay? So more or less I'm feeling here and I'm feeling twitches here, okay? And we have avoided to go through the skin, okay? So this is useful for both flexor digitorum brevis and quadratus plantar. Okay?